Hello, and thank you for joining us tonight for our free webinar, Incorporating Facial Acupuncture into Your Practice, featuring Michelle Gellis. My name is Jeff Bloom, Education Marketing Coordinator here at L.A.C OMS. For over 40 years, L.A.C OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. We recommend viewing the webinar in either Chrome, Firefox, or Safari, as you can experience slowness in other browsers. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions, please use the Questions tab to ensure that our guest speaker answers them at the end of the lecture. Please note that each webinar is recorded, and immediately following the conclusion of the webinar, you will receive an email with a link to view the video on demand. We will also share the recording with slides and any other complimentary material in the following week or 2 on our blog. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From sports acupuncture to CBD to practice management, you will find something interesting for every practitioner on the L.A.C OMS blog. Now for our featured speaker, we are on to Michelle Gellis. Michelle is a licensed and board-certified acupuncturist. She has been a faculty member and clinic supervisor at the Maryland University of Integrative Health since 2004. Michelle holds a Bachelor of Science degree from Seton Hall University School of Business and Computer Science and an MS in acupuncture from Traditional Acupuncture Institute. She teaches classes on facial cupping, gua sha, and treating neuromuscular facial conditions such as stroke, MS, trigeminal neuralgia, TMJ, and Bell's palsy with acupuncture. She has been published in the Journal of Chinese Medicine, Acupuncture Today, the Maryland Acupuncture Society newsletter, the Acupuncture Desk Reference, as well as In Her Mind magazine, Howard County Business News, and Bee World magazine. Please join me in welcoming Michelle.
Thank you, Jeff, and thank you, L.A.C OMS, for the opportunity to provide this information. Something just happened with the slides. Let's see. So what I am going to cover today, this is my bio, and I assume everyone, if you want, can get a copy of these slides. So if you want to look at my publications or review any of this material, hopefully it'll be in the slides. So today, what I would like to speak to everyone about are kind of an intro to facial acupuncture, what it is, what it isn't, and why it's beneficial for your practice and why it's beneficial for your patients. Also, I would like to talk about the full body nature of facial acupuncture and why it's important to include a full body treatment when you're doing facial acupuncture. Also, the importance of being trained, and I'll review some of the highlights of certification and training. Also, I'm going to talk about marketing and advertising and incorporating facial acupuncture into your practice. And last I'm going to talk about are some of the tools that we use when we do facial acupuncture, and kind of thoughts about some of the different things that you might use when you're performing facial acupuncture in your practice. So what exactly is facial acupuncture? You'll notice that I purposely do not just call it cosmetic acupuncture, because as an acupuncturist, as a practitioner, I incorporate facial acupuncture not just for cosmetic uses, but also to treat any neuromuscular condition that involves the face. So things like Bell's palsy, TMJ, trigeminal neuralgia, stroke, ptosis, and many others. Facial acupuncture, when we think about it, we always think of the kind of the cosmetic end, which I will talk about and which is very important, but the side benefit to getting trained in facial acupuncture and to really having a good grasp on it is that you can use it for all of these other conditions as well. When I talk about facial acupuncture, I am talking about not just the needles, but also incorporating facial cupping, gua sha, and possibly using microneedling or a derma roller. And facial acupuncture is not some new trendy technique that the Kardashians are doing. Or other celebrities. Facial acupuncture has actually been around. It's been recorded as early as the Sung Dynasty. They found some jade gua sha tools buried with the emperor and the empress. There have been a few studies on facial acupuncture, and I've listed them here. So you can look them up. And some of them were larger, some of them were smaller, and some of them affected the facial wrinkles, depth of the wrinkles, thickness of skin, color of the skin. Other studies had more to do with facial function. So the neuromuscular piece that I'm going to talk a little bit.
Hey, Michelle?
Yeah.
Sorry to interrupt. Do you see the little bell at the top of the screen next to action?
Yes.
Can you click on that? Let's mute the notifications.
Okay.
Okay, perfect. I'm leaving you now.
That's okay. I did notice that every time someone new logged on, it made a sound, but I was just going to keep going.
Thank you. Sorry.
So, where was I? One of the big questions I get asked frequently is, does it work? Does cosmetic acupuncture actually work? So I'm really not big on before and after pictures, and partially is because most of us don't have professional studios in our room, and the lighting can make the difference. Even if you're not using any filters or anything on your camera or your phone, the lighting in the room can make such a difference, and it can really be difficult to take a before picture and then a few weeks later take an after picture. But I do have a few, and I just wanted to show these to you. The first one on the top left was a patient. This was actually taken by one of my students out in California, and it was, excuse me, sorry. This was taken during a facial cupping class. So this was just from doing some cupping. The next one on the top center is a patient that I was treating that had a scar, and after several treatments, you can see that the scar wasn't as thick and lumpy as it was when she first started coming to see me. To the far right is another patient that I saw for quite a while. She was in her 70s and didn't wear a lot of sunscreen. Back in the 60s and 70s, back before we had sunscreen, we just had suntan lotion. So a lot of people if they spend a lot of time out in the sun. She's an avid gardener and hiker, and she had a lot of sun damage around her chin. And after about 12 to 14 treatments, you could see the depth of the wrinkles on her chin were much less, and things really were smoothing out. Even the corner of her mouth wasn't as turned down. When you treat the orbicularis oris muscle, it helps to lift those corners of the face so your patients won't look like they're frowning all the time. On the bottom center is a patient who had a lot of dark spots, and I used some intradermal needles on her. And as you can see, over time, this one spot in particular faded quite nicely. Couple more pictures. This patient of mine on the left had very deep lines in her forehead, and after a few treatments using some intradermal needles, some facial cupping, some gua sha, they dissipated quite nicely. And I did work with her on a big reason why people get these wrinkles is, Jeff, all of a sudden everyone's comments popped up and I lost half my screen. I don't know what happened. Okay, well, I'm just going to keep talking.
What happened, Michelle?
I lost half my screen and everyone's comments are underneath.
Is there the little arrow that has hide sidebar?
No.
In the top right-hand corner?
No, but I can.
Can you make it
Nope.
full screen?
Huh. It's just the strangest thing. Okay, I'm just going to ignore it and just, I mean, my slides are just very tiny now, so I'm not quite sure. It just did it all by itself. Wait a minute. Maybe I can do this. That didn't. Okay. Back to normal. No idea. Okay.
Thank you.
Okay. So this other photo, I had a patient who I guess she had been seeing me for years for neck pain and elbow pain. Kind of on and off, it would come and go. And she had seen some magazine article about cosmetic acupuncture. She wanted to know if it worked. And her chief complaint was that her eyelids were drooping. So I said, well, go ahead and get on the table. And I treated one eyebrow. Did a series of needles, protocol that I use, and while she was laying on the table after I took the needles out, I took the photo and I showed it to her. So now she's coming to me for cosmetic acupuncture. So the bottom line is it does work, and it's actually quite effective. And my patients that come to me for cosmetic acupuncture tend to come very regularly for initially for a series of treatments, and then they'll come once a month for a touch-up. So that leads us into the benefits of facial acupuncture for your practice. The main benefit for you as a practitioner is not only going to be the financial piece, but also it is another way in to help your patients kind of with some of the underlying emotional things that are going on. And I'll talk about that in a second. But people tend to spend money on vanity before they will spend money on their aches and pains. So cosmetic acupuncture will bring a steady, reliable stream of income There's no insurance involved, so it's cash income. And it also widens the scope of your practice. So if you never really felt comfortable treating people's faces, or you weren't all that familiar with facial points, or you didn't know what to do if they had TMJ, or they have ptosis, which is a drooping eyelid, or your Bell's palsy treatments were just kind of whatever you learned in school and you've just been doing the same thing, then having these skills under your belt can really set you apart. Knowing the facial motor points, which are not widely taught, and other techniques like submuscular needling, incorporating some scalp acupuncture in specific for the face. All of these things can really work together to set you apart, and you will be known in your area as the person to go to for different muscular facial conditions and for cosmetic acupuncture. So here's a photo of some facial gua sha, and here I am. I was teaching a class using a derma roller. So the benefits for your patients is facial acupuncture is not just something that works with the face. It works with the body because you should be doing a full body treatment and helping the organs to function better. And that way it will bring chi and blood up to the face where you're putting the needles locally. By treating the organs, you are helping their digestion, their immunity, their circulation, and also reducing inflammation, which can cause a lot of the redness, the rosacea, and things of that nature. When the needles are threaded, and when you're using some of the intradermal needles and even treating the acupuncture points, you are telling the body to bring nutrients and blood and chi to these areas, and this will help to stimulate collagen and elastin production. And collagen and elastin are what help you hold your face up. So it can help with double chin and really tightening the face, all the sagginess that can go on as we get older. So even if you don't have wrinkles, there's only two types of faces out there. There are ones that have jowls, and there are ones that will have jowls, because everyone's face over time starts to sag. Gravity, loss of collagen, loss of elastin, loss of bone, loss of muscle, loss of fat. All of this goes on as we age. And when the skin doesn't have anything to hold on to, it starts to sag. So by keeping the energy going in the face over time, it can be very beneficial to the overall appearance. And again, going back to the neuromuscular piece, if someone, let's say someone had Bell's palsy 5 years ago and they still have some residual neuropathy, using facial acupuncture can help to stimulate the area, especially the facial motor points, if you needle them properly. And they do have to be needled properly because the face is very heavily vascularized, and knowing where the facial nerves are and all the anatomy is very important. If your patient has had a facelift, it can actually make the facelift last longer. The average facelift only lasts about 6 years. People think a one and done, but it's not. It's something that people spend a lot of money on. They go through a lot of downtime, a lot of pain, and then 5 or 6 years later, they have it done again. And as I said, facial acupuncture will help to decrease some of the fine lines and wrinkles. Here's a photo of a patient. She was young, in her 30s. She had ptosis and she was getting married. And she was concerned how she was going to look in her wedding pictures. She had had it all of her life, and it was in her right eye, on your screen on the left, but in her right eye, her lid was lower than her left eye. And when she would get tired, it would get worse. Now, these are not photos that I took. These are photos that she had, that she gave me. So you could see before treatment and then after treatment how much better and more symmetrical her eyes were. She was very happy. And of course, you don't just treat the eyes. I treated the underlying conditions that I felt were responsible for the ptosis. That kind of ties in with you're treating the inside and the outside at the same time. The thing that I tell people when they call me on the phone is, unlike other things that are done nowadays, the injections and the fillers and the different things, they just work on the outside. You're not really getting underneath any sort of emotional thing that might be going on with the person that's causing the habitual expression lines, such as any habitual pattern of emotion is going to cause lines on your face, whether it's grief or anxiety. They're all going to get lodged in your face. And as I've said a couple of times, again, it helps with the neuromuscular conditions as well. Here is another student of mine in class who had rosacea, and I did some cupping on the right side of her face. And I didn't even notice. One of my students pointed out that first the redness, it flared up a bit, and then it cleared completely on the right side. And so we got a picture. In addition to just locally helping to clear some of the heat, done properly, facial acupuncture can help to balance hormones, and that ties into a lot of the issues that cause problems with the skin, whether it's acne or whether people have melasma is hormonally, well, that and the sun, but it has a lot to do with hormones. So treating the hormones and the skin, it can get underneath some of the other skin conditions, not just aging skin conditions. So let's talk a little bit about training. I'm going to take a drink of water. So if you can't tell, I'm in a hotel room right now because I do travel quite a bit. And Jeff asked me if I had a cup of water before we got started, and all I had was this big water bottle. So I grabbed one of the cups here in the hotel. So can you guys see this? I figure I'd add a little levity to the webinar. It's terrible because I can't hear you guys at all. So I hope you're laughing. Let's see. Training. Why is it important that you get trained? Well, there's a lot of things that go into facial acupuncture class, and I'll talk about some, and I'll show you some photos too. The American Acupuncture Council actually requires that if you are going to perform facial acupuncture and you use their insurance, that you have to get trained by someone who is on their list like myself, there's just a handful of us in the country who are registered with the American Acupuncture Council to do cosmetic acupuncture training. And you might wonder, why is this important? Well, there are a lot of contraindications and things that might not be obvious that you didn't learn in acupuncture school that you need to look out for when you are doing cosmetic acupuncture. So there are special release forms that patients sign when they're getting cosmetic acupuncture. And knowing what to ask for and what to look out for as far as any previous procedures that have been done on their face, how long do they wait before they get cosmetic acupuncture? Is it okay to get cosmetic acupuncture after they've had Botox? And you know, things like that are important to know. And I get questions like this all the time. I have a Facebook group, probably got about, I don't know, 5,000 or 6,000 people in it. And they ask me all the time about the different things people are putting in their faces and whether it's okay to have cosmetic acupuncture when they've had these. So learning some of the red flags and the contraindications, learning how to pre-screen patients for these contraindications, and knowing some of the potential side effects, things that can go wrong if facial acupuncture is not done properly. For example, if someone suffers from migraines, or if they've had a stroke, wait a minute, I'm going off topic. Let me start again. If facial migraines are a contraindication, and if someone comes to you for cosmetic acupuncture, some of the side effects can be a headache. If things really went awry, you can raise their blood pressure a lot. They can get bruising. They could potentially faint. And so you have to pre-screen people for potential contraindications, and then you have to know how to treat someone properly so that these things don't happen. And they're very rare. I don't want to scare people, but done properly, cosmetic acupuncture is very safe, but you do need to know what questions to ask. And what I did here was I put a little picture of the face and all the facial muscles. There are 44 muscles in the face, and really understanding the facial muscles and the neuroanatomy is important when you are doing facial acupuncture. The face is the only part of our body where the skin is actually attached to the muscle and muscles attached to the bone. And that's why we can move our face, but we can't move the skin on our hands if we want to, or the skin on our arms. And so there are a lot of unique things about the face, the number of muscles per square inch. Some of them are thin, some of them are thick, some of them are superficial, some of them are deep. And some of them you really can't even get to. You have to either open the mouth or things of that nature. But really understanding where these structures are can go a long way in preventing bruising or some other concern. And really, it should be taught in a hands-on environment where someone is supervising and watching, because you might think you got it, and unless someone actually has eyes on you, you may not really have the technique. So I see these all the time, every day, Instagram, and well, all over social media, people posting pictures. They're very proud of their cosmetic work that they're doing, and some of it is horrifying. So I just put a few pictures up, and the one on the left, besides that there's way too many intradermal needles, they're not inserted deeply enough. It must have taken forever to put all those needles in. You really don't need that many intradermal needles when you're treating wrinkles. The next picture, not only are some of the needles in way too deep, but they're very close to the jugular vein. That is just scary to me. And the last one, I don't even know what the one was doing. But what happens a lot of times, I think people just try to wing it. They just say, well, I know how to use needles. I'm licensed. I'm going to give it a go. And it doesn't always work so well. So here are some examples of some good needling. And on the left is some threading with 1/2-inch needles. And on the right is a threading technique of the platysma. It's something that I teach, and it's, you know, it's fairly complicated to learn, but once you've practiced it, and you know exactly where to put the needles, as you can see by looking at the picture on the right, things could certainly go awry if the needles were not placed properly between needling into the lungs or needling into venous structure, or hitting a nerve, a facial nerve. So anyway, I have a lot of these photos, and I have a lot of short videos that I post in my Facebook group. I just give this stuff away. I mean, in little bits and pieces. I do a facial acupuncture tip of the week. So here's some more examples of some good techniques, some intradermals that are placed properly, and then versus someone who just, you know, went crazy putting intradermals in their forehead thinking more was better. So I'm going to show a video now of, this is kind of a freebie giveaway. This is from one of my classes. It is I have an advanced skills class that I teach. It's a half-day class that I offer at the end of my 3-day class. And this is part of a series of treatments that you could do to help to tighten and lift the neck area. Hopefully I remember how to do this.
In order to locate the digastric muscle, you will use one finger, and you will locate the mastoid process right here. And you also want to locate the hyoid bone, which is right here. What you want to do is draw an imaginary line between the two of them. And then using your index finger, you're going to palpate along the line, and you'll find a very thin muscle right here, and that is the posterior digastric. And if you draw an imaginary line between the hyoid bone and the underside of the chin, you can palpate for the front of the digastric muscle. So the digastric goes from the mandible, and then it kind of takes a turn here and attaches back here at the mastoid process. So part of the digastric muscle that we're going to needle using submuscular needling is right here underneath the chin, and this will help with the if someone has excess or laxity there. So to feel the digastric muscle on the interior, you're going to ask your patient to open their mouth. Go ahead and open your mouth and close it. And you can feel the underbelly of the digastric muscle. It's about the width of a pencil. So again, it comes from here, and then it comes up to the hyoid, and then it attaches here. So what you're going to do is, once you've found the muscle, you're just going to kind of grab it with 2 fingers, and you're going to just use a 1/2 inch red sarin needle and get right underneath like that. And you can usually get 2 needles in, just like that. And then you're going to come along on the other side. And you're going to be right here. You're going to get right underneath the muscle like that. And then one more. Get right underneath like that. And then you're going to do the same thing on the other side. See how there's the one muscle is right over here, and then the other one is here. So we just kind of crisscross the needles.
So I teach submuscular needling in kind of, it's sprinkled throughout my lectures, and it can be used, different muscle groups, for different purposes, and that was for the neck. So I touched a little bit on full body treatments and why are they important. And if you aren't treating the underlying conditions, like I said, whatever the problem was, you might be able to temporarily look better, but it's just going to come back. So, for example, if someone has liver spots and they have stagnant liver blood, you want to treat locally, and you also want to treat their liver, because just doing a localized treatment can help, but then the spots are going to come back. Whether the person is yin deficient, qi deficient, blood deficient, has some sort of a stagnation or a deficiency or an excess, it is going to show up on their face. This person on the right is example. This was a smoker, lung yin deficiency. And additionally, treating the body helps to ground the patient while you're working on the face. You wouldn't want to be putting a bunch of needles into someone's face without having properly grounded. Also, I'm a classically trained 5-element acupuncturist. I went to a Worsley school, and we're all about the emotions. So really, when you're treating any of the organ systems, whether you mean to or not, you're treating the emotional partner of the organ. So if you're treating the liver and the person has some sort of liver stagnation, you'd be surprised at how nicely it helps with the expression lines. So the single expression line between the eyebrows is said to be liver, the 2 is gallbladder, and then if someone's really angry, they'll have wolf lines on the side of their nose. So you want to stay away from those people. You don't want them to be your friends. One of the important things about getting trained is learning how to incorporate facial acupuncture into your practice. Because I think there are a lot of misconceptions I hear from my students and just from other acupuncturists. And if you have specific social media for the cosmetic piece of your practice, and you advertise that you understand and know facial acupuncture, you have a separate web page for it, it can really be a draw to your practice. And the part of facial acupuncture that I think there is a misconception about is that it's very time consuming and you have to use all these needles. And once you've practiced a little bit, there's no reason why you can't have 2 rooms going at once, and you don't need to be putting hundreds of needles in someone. The needles, when I put needles in my cosmetic patients, it takes me about 15 minutes. Then I can go to another room, do the same thing. Patient number 1 is laying on the table and resting, and I can go back and forth, take the needles out, do the cupping and gua sha, go to the other patient. And I charge almost twice, well, actually more than twice, what I charge for a regular acupuncture treatment. So it is very beneficial in that way. And you can convert your, if you do enough social media marketing and good marketing on your webpage, your patients will start to ask for it. They'll know that you do it, and so their shoulder may have gotten better, but now you have something you can offer them that will help them not only with their pain, but to feel good about how they look, because for many of us, when we look good, we feel good. And when we feel good, we look good. So treating the outside also treats the inside as well. Some of the tools and things that I use in my cosmetic acupuncture practice, I am not really big on a lot of gizmos and gadgets and lasers and lights and electricity. I know for some people they do use a lot of these things, and I think there's probably a lot of benefit to it, but I have always kept my practice very simple and basic, and I like to be able to just treat someone with some needles and cups and a gua sha tool. So I carried that over to my cosmetic practice. I only use sarin needles, and everyone that I have studied with uses sarin needles. Even people from other countries that I have studied with use needles. And the reason is, I don't want to do a commercial and infomercial for sarin, and this has nothing to do with the fact that L.A.C is sponsoring this. They really are best made needles. And I've had tried other needles on the face, and my patients bruise more and they have more pain. So that is something when I'm teaching, I go off on a tangent about using really good quality needles, because you don't want to cause any hematomas or any unnecessary swelling in the face. The cups that I like, L.A does carry them, but they're glass cups. They're not plastic and they're not rubber. They're glass cups, and the rubber part of them is, it doesn't have a seam on it, so it can't break. And they're really, really easy to squeeze. I am really old, and my hands are getting a little arthritic, and like regular cups that you might use on the neck, body, are they can be very difficult to squeeze. So these are easy to squeeze, and they're hand-blown glass, so they glide well. And I guess Jeff hopefully will have some information about the different products. I like Jade gua sha tools, and that is a gua sha tool there in the picture. And when I insert intradermal needles, which are those little tiny needles that you put into wrinkles, I use the Tweezerman tweezers with the wide grip, and they have like a slanted tip on them. And then arnica gel. Before I insert needles, I put arnica gel on the face to help to prevent bruising. And lastly, the only device that I work with, and I actually don't use it in my treatment room, I sell it to my patients, is especially people who have skin like this patient of mine here, where on the right, where she has so many fine lines and wrinkles. You wouldn't want to be putting needles into all of those wrinkles. So using a derma roller, which is a handheld device, it has tiny needles on it, and you roll it on the skin, the person on the top left, and it helps to stimulate collagen. Something else that can be used on the skin, put serum right in it, is a hydro roller or a hydro needle. And these are all my products. Aculift is my company, but L.A does sell them. And they're great because if you're traveling, you can just throw some serum in it and either roll it on your skin or stamp it on your skin. And they have little needles in them as well. So they help open the skin up so that it can absorb products. Whatever product you're using on your skin, it helps to absorb the product. And the microneedling, it's also known as collagen induction therapy. It helps to stimulate collagen because your body thinks it's been wounded. And so it creates more collagen. In conclusion, facial acupuncture can have a lot of benefits to your patients and for your practice, and providing full body treatment along with facial acupuncture is very important. Getting properly trained is really key to having safe, effective facial acupuncture treatments. Incorporating facial acupuncture into your practice is very easy. You don't need to buy a lot of stuff. It doesn't have to be very time consuming. And lastly, using good quality tools is very important. So that is the end of my lecture. And now we are going to open for some questions.
Thank you so much, Michelle. That was amazing. We actually have a lot of questions. So let's get started. Actually, the very first thing is actually multiple people have asked about what's the name of your Facebook group so they can find you.
Oh, hold on. I'll have to look at my phone. I changed the name. It's called Facial Acupuncture.
All right. Facial Acupuncture.
But when you try to join, it's going to ask you 2 questions, and you have to answer them. So.
Hello?
Hello? Did you
Did we
lose?
lose her?
Are you
Oh,
there?
no, we still have you.
Okay.
Yep. All right, so search facial acupuncture on Facebook. That's how you'll find Michelle's group, and then you'll have to answer a couple of questions to get in there. So let's get started on these questions if you have a couple minutes.
I do.
Let's see. First one, do you use any skincare lines?
I do. And right now I am using Dr. Kim Black Caparelli's line. It's Gracefully Made USA, and L.Ac carries it. I have never promoted any skincare products in my classes. I feel like people come to learn facial acupuncture, not to talk about products. But I told Kim, Dr. Kim, if she would make me a collagen, vitamin C, hyaluronic acid serum, all in one, because I got tired of having to use all these products, that I would mention her products in my classes. And so I do use her serum, and she's got a great cupping oil, which has arnica and CBD in it, which is great. And anyway, but I use her products, and then every once in a while I'll buy something and try it. But really, that's what I've been using for about the past year or so.
All right. Next question. Looks like it says on your let's see, on your slide, you were going to say something about teaching the patient not to wrinkle their forehead.
Yeah.
Do you remember what you were going to say there?
Well, I could tell you what I would say. Facial expressions, some of them are so habitual we don't know that we do them. So as far as the forehead, the line between your eyebrows, as far as the line between your eyebrows, if you need to show concern, you can lift your eyebrows up instead of pushing your eyebrows together. It's a little trick, but because there's two reasons why we make that expression, right? If we're worried or upset, or if we're angry. So hopefully the angry thing, you can be angry without having to make the angry face. Or just don't be as angry as often, because it's the habitual expressions. And if you don't express an emotion, and this is shown in studies, if you don't express an emotion at all, that's not good either. So I'm not saying don't express the emotion, but keep it in check. The other thing I tell my patients is to take a mirror, and when you're sitting on the phone, have a mirror in front of you and watch yourself, or put a webcam on and see the expressions that you make, because most of us aren't aware of our facial expressions. Some people purse their lips a lot, and they end up with lip wrinkles because of it. So they might not smoke or drink from a straw. Those are two big things that lip wrinkles. They may just make that facial expression a lot.
Very interesting. Looks like Shelley would like to know, in her last with facial rejuvenation, it was recommended not to use facial acupuncture with facelift patients or people who've had Botox because it can reverse it. Do you agree?
Wait, say that again. I only heard the Botox. What was before the?
So it sounds like she was told in a previous course that she should not use acupuncture with patients who've had a facelift or Botox. Do you agree?
Okay. Yes and no. If someone has had a face, you have to wait a full year until after all the swelling and inflammation goes down. Although the face is very heavily vascularized and has good blood flow, the inflammation in the face can take up to a year to go down. So you wouldn't want to touch their face for a full year. After that, the important piece is the documentation. Is there an area of their face that's still, they're having some neuropathy or pain? Is there something they're not happy with? And I go through this, when I'm teaching, I go through step by step all the questions that you want to ask, because facial acupuncture will make the facelift last longer, but you do have to wait a year. As far as Botox, our needles will make the Botox wear off. So you want to avoid the area, and because it will make the Botox wear off, unless they want the Botox to wear off, in which case, as long as you're doing your documentation properly and you wait until after the Botox is settled, which can be anywhere from 2 weeks to a month, you really don't want to mess with the area, because if they do get some unwanted paralysis from the Botox, like eyelid droop or something, they could blame you, and you don't want that.
All right, next question is from Sophie. For a double chin, would you suggest acupuncture first or cupping?
Well, not just for a double chin, but in my protocol, I do acupuncture and cupping and gua sha on all my facial patients. Does that answer the question?
Well, she wants to know, would you do it would you have an order in which you do it? Would you do the acupuncture first and then cupping and gua sha?
Yes.
All right, next question. Is cosmetic facial acupuncture okay for someone with high blood pressure? And have you personally treated somebody with high blood pressure?
That is a very, the question has a very long answer. I'll probably spend about a half an hour talking about this in class. But the short answer is you really shouldn't be, you definitely should not be treating people with uncontrolled high blood pressure, period, with cosmetic acupuncture. And beyond that, it gets a little more complicated. It depends on how it's managed, how high was it, what is the experience and skill level of the practitioner. But I tell my students starting out, you don't want to be treating people with high blood pressure as your first patients. I mean, it does bring a lot of energy up to the head, and this way.
All right. Next question is on the face. What should be the direction? Upward from the ears side to chin. What is the direction horizontally?
Direction of what?
For needling.
Well, it depends on what you're doing. I typically in my protocol, I needle up. I always want the energy to go up, but if you're using intradermal needles around the lip, on the top lip, you have to go down. So it really depends on what part of it's like a big question, and it just depends on what part of the face you're working on.
All right, next question from Kevin. Can cosmetic acupuncture help with actinic keratosis? I probably butchered that.
Yeah, no, I know what that is, and yeah, a lot of the dermatological stuff. My class is not a dermatology class. I go through some basic common skin conditions, and many of them you're going to be doing the same sort of treatment you would be doing if the person came to you for acupuncture, because all of this stuff starts on the inside. So you really have to get to the root of the problem, and then depending on what the skin condition is would determine whether or not you'd be moving the face, to release heat or to move blood or whatever.
All right, next question. Oops, sorry. what is the frequency of treatments for facial acupuncture?
Well, initially I see my patients once a week, and but you can see them as often as every other day. And I usually will treat them once a week for about 3 months, because it can take up to 3 months for collagen to form. People who are younger produce collagen more quickly. People who are older, it's more slowly. And then once they've gotten to a point where they're happy with the results, then we spread the treatments out.
All right. And then next question, about how many minutes do you spend on the cupping and gua sha portion of the treatment?
Well, you can spend as little as 10 minutes doing cupping and gua sha, or I have some patients that just come to me just for facial cupping and gua sha, and I'll spend a half an hour yet. So it's a balancing act. You know, how long did you spend putting the needles in? How much time is at the end of the treatment? And but I like to spend at least 10 to 15 minutes doing cupping and gua sha.
Okay, and then Melanie would like to know, is the arnica gel applied before or after the needling?
Before, and sometimes after. And sometimes I use, I have Yunnan Biao liquid and spray that I'll use if I see a bruise cut. They're not that frequent, but they happen. So you have to really learn how to look for the facial veins, and then you can avoid them. But every once in a while, there's a tiny little capillary and it will bleed.
All right, so you're saying before and after. And then next question is, how do you address the microbleeding exposure from the treatment when applying oil and touching the face for cupping and gua sha?
So the question is, if the person is bleeding and then I do the cupping and gua, well, I'm not going to do cupping and gua sha on someone who's actively bleeding. So I'm not quite sure I understand the question. I mean, if someone had any blood on their face, their face would be cleansed. There would be no bleeding going on while I'm doing cupping and gua sha.
Okay. And then next question is from Monica. Would you cup a patient before or after the needling portion?
I think I already answered that.
You did, right. Let's see. Savannah wants to know, what can be used to prevent bruising besides arnica? She has a patient allergic to it.
Yeah. Well, the Yunnan Biao could be used, but you don't want to get that too close to the eyes unless, because it's just, the fumes can be a bit much. Really, there's a helichrysum hydrosol, which it can be used. I haven't found it to be as effective, but it's also in the flower family. So if the person's allergic to arnica, they're probably allergic to daisies. So I don't know if they could use helichrysum.
All right, so we'll go to the next question. Needy wants to know, what is the depth of your microneedle millimeters wise?
Oh, the derma rollers.
Yep.
I have 2 needle lengths for the face rollers. The one is 0.5 for people who are have sensitive skin, thinner skin, older skin, and 1.0 millimeter for people who have thicker skin, more youthful skin, less sensitive skin.
All right. Next question. The dermal needle rollers and serum bottle rollers, are those disposable single-use products?
They're single person, but not single use. Derma roller will last 3 to 4 months, and the serum products that you put the serum in with the needles, they last about a month or so. They get kind of gunky, for lack of a better technical term. But I do have sanitizing tablets that you guys will be carrying, or people can, they can go to my, well, anyway, I have sanitizing tablets that L.A.C will be carrying soon. Hopefully real soon.
And are those for the serum rollers and needle?
Yep. You throw your cups in there, your gua sha tools, and they're very safe. It's hydrogen peroxide. I mean, it's like 20 different ingredients, but it just kind of bubbles a bit, rinse everything off, and it's safe for the skin.
And then what kind of serum do you suggest for those?
I'm so glad you asked. I love Kim's Super Serum, the gracefully made Super Serum. If you're not going to use that, you want the serum that you put in there to be the consistency of oil. You don't want it to be too thin or too thick. Like, you can't put lotion in there, and you wouldn't want anything too watery. But you could put vitamin C serum in there. You could put homeopathics in there. You could put hyaluronic acid, collagen serum, any serum that you're using on your face, you could put inside that glass container and use it.
And actually, what are the length of the needles on those, on the Hydro Roller and the Hydro Needle?
They are 0.5.
0.5. Perfect. Next question is, are you planning to do a training in Canada?
Well, I just did a training in Vancouver in September, and I really loved Canada, and I may come back, but I haven't done right now my schedule is only planned out through my London class in June. So my schedule is planned out through June, but if I go to Canada, it would be late summer, early fall 2020.
All right. Well, stay tuned for for more dates coming. Let's see. We still have more questions coming in. So if you're still able to answer them, I'll keep asking.
Go ahead.
Savannah would like to know, is Moxa ever part of your treatments?
Not on the face. No.
Well,
I mean, yes, but not on the face.
So we actually have some samples of some Moxa from Japan that they're saying is actually specially made for the face. So if you'd like, I'll send you samples, and then the next webinar we'll talk about if you liked it or not.
No, I mean, the idea of it is great, but I'm such a safety gal, and I just, it's one thing for someone to have a bruise that'll go away in whatever, a few days, but I just worry, even with ginger or whatever, I just worry about burning the face. So
completely understandable. Next question is, for those of us who live abroad and can't get to your class, are there any online courses that you would recommend? And I know you say it's better to be supervised, but that's not always possible.
Well, I am coming to London, so, and I don't know, on one more country, but I do have recorded webinars, and I am considering so my recorded webinars are facial cupping and gua sha, treating neuromuscular and treating neuromuscular facial conditions. My actual 2-day class is not available as a recorded webinar. But after I finish my third journal article, I think I'm going to go ahead and record it because a lot of people ask. So.
All right. Well, all of you guys will be receiving an email with links to all of those upcoming classes and schedules. So take a look at where her upcoming classes are, and hopefully you guys can attend those. Let's see. Next question. Ellen wants to know, why do you feel you need to do cupping and gua sha after needling the face?
Oh, well, the facial cupping brings so much blood and chi up to the skin. It feels absolutely marvelous. I feel like my patients tolerate the needles so they could get the cupping and the gua sha. It doesn't take that long, and it really works so much with the blood flow and the muscles, and really can smooth out, like on a physical level, smooths out a lot of the fine lines. And I treat myself, and I sometimes get lazy about putting needles in my face, but I always have some facial cups with me and gua sha tools. And when I travel, it feels good. And I don't just do gua sha on the face. I work on the scalp, on the trapezius, all of that, because if you're tight in the back of your neck, it's going to go up into your temporalis, which is attached to your face. It's all connected. And with everyone all hunched over like this all the time, people have so many neck issues, and it's affecting people's faces. So, you went away, Jeff.
Right.
You still there?
I'm still here. Can you hear me?
I can hear you. I can't see you though.
Oh, interesting. Well, I do have another question here. Let's see. What treatment do you use for enlarged pores, and can we use the derma roller for that?
There's actually an acupuncture point that helps for enlarged pores, and it's D25. So it works pretty well. And the derma roller is great because it's a wonderful exfoliator. And when your pores are large, it's usually because they're clogged, which is why people that have oily skin, their pores look larger. You can just see more of it. And then as you get older and your skin is thinner, you can see more of the top part of the pore, which is why our pores look larger as we get older. So by using a derma roller, it can help to keep the skin turning over and not atrophying. And yeah.
Right. So what is the expectation when an individual might need the next round of facial acupuncture after the initial series?
Well, they don't stop. My patients will come once a week for several weeks, and then once they're happy, or once we've ascertained that they're in a good place, then they continue to come like every other week, once a month, indefinitely, just like people color their hair, polish their nails, brush their teeth. Any other sort of grooming that you do, you don't just say, oh, my teeth look great, I'm just not going to brush them anymore. It's the same type of thing. I work with young patients as well. They have to go through the whole series. They don't have a lot of the aging, but it's preventative for them. It's like getting a wonderful acupuncture, like a really deep level.
All right, and then looks like we got a little clarification on the question about bleeding and using the oil. So let's see. So the question about microbleeding was if a point bled, how do you clean the face again before applying the oil to cup? And do you wear gloves?
Or gloves. I don't wear gloves in my treatment room, period. And I mean, the amount of blood that I've seen from my patients from a needle is, you know, it's, again, I use sarin needles, so there's a lot less trauma, and I'm serious, I'm really serious about this. They really do cause a lot less trauma to the skin. But if my patient was bleeding, and I mean, I personally don't have an issue touching their face, like putting oil on it, but I put the oil on my hands and then I put it on their face. But if there was, you know, blood on their face, I would I keep wipes in my treatment room, or I would have them wash their face before I use the cups. And then I have several sets of cups, and you know this because you're always sending me cups. And I would take those cups, I would use them on that patient, and then they'd have to be sanitized before I use them again. Right. It's really not, I mean, like no one's ever asked me that question before. I've not thought about it because bleeding just isn't a real big issue. And those of you who've taken my class, you know, I might have 40 people in a class, and there's no blood going on, so.
Right. Next question. When needling face points such as stomach 2, 3, 6, and 7, do you just tap the needle in and leave it, or do you tap it in and then insert it a little deeper?
Oh, well, that we're getting into like serious technique there, because for each one of those points, I'm going to do something different. And we don't have enough time. I mean, I don't even needle stomach 3. I have a stomach 3.5 that I use, and I do it under the jaw. So it's to lift the face. So really, for really specific questions like that, you probably want to take a class, because I couldn't go through my whole protocol now.
Understandable. And then Kristen would like to know, after the webinars, would it be safe to try these techniques, or would you recommend not trying any of these until you take one of the classes?
Well, the facial cupping and gua sha classes that I teach, certainly the webinars, you should learn enough during the webinar to safely practice them, because they're relatively safe techniques. As far as needling, I mean, this webinar was not in any way, shape, or form my 16-hour facial acupuncture class. This was just kind of an overview. So I would not recommend going off and trying anything we talked about today based on, you know, this was just an overview of facial acupuncture and how it can benefit your practice, what it is, what it isn't, those types of things.
All right. We have a few more left. And next question, when you're treating sunspots or hyperpigmentation, do you only use intradermal needles?
Typically, yes. Yes.
Okay. And then, is it advisable for us to do facial acupuncture on ourselves?
If you've been trained. Otherwise, you could mess yourself up. You'll end up looking old. Hold on.
Yeah. What are your thoughts about medical microneedling going deeper than 1.5 millimeters?
Yeah, it's messy. It's very bloody and painful. From what I understand, I haven't had it done, but I've spoken to people that had it done. You know, I'm sure it's effective, but I don't enough about the procedure. I haven't had it done. So my thoughts are that it should be done by a medical doctor. And my concern would be that it could cause scarring. You know, anything that causes that much trauma to your entire face all at once, I would be concerned about scarring.
Okay. A few more left. Let's see. Would you use the derma roller on rosacea?
Well, that's kind of one of those, what I do and what it says on the box. So I would, as an acupuncturist, I would use it, but you know, theoretically, derma rollers are meant to be used on skin that's healthy, like aged or has stretch marks or has pock marks, but not skin with open sores or a lot of redness. But it really can be used in the same way that you would use a 7-star hammer. But it doesn't, derma roller should not cause bleeding, whereas a 7-star hammer does.
Let's see. You mentioned facial acupuncture can be used to treat acne. Does this also include cystic acne?
Yes, and I wouldn't be needling into that area, but I would be treating the person constitutionally and doing needling, but not in the area. Like, for example, if the person had a lot of stomach heat, I would do some stomach points, not just, you know, body points to treat the underlying condition, but I might do some stomach points on their face.
And then what do you think about microcurrent?
I am not a big fan of electricity on the face, and the reason is I work extensively with people who have facial tics, neuropathy, paralysis, asymmetry, all sorts of neurological facial issues. And unlike the rest of the body, the way the face is innervated and the musculature of the face, I mean, I have concerns about the safety of running electricity through people's faces, even if it's just microcurrent on the skin level. Anyone, if you've ever had a facial tic, what I mean, because some of the muscles are very superficial, and some of the nerves are very superficial. So.
And we have one more question left. Okay. Can you kindly recommend an acupoint to reduce hyperpigmentation on the face?
1 point? The pressure. Hyper or hypo?
Hyper.
Yes. Well, okay. Yes and no. I have to retract that. It depends on why they have it, but sometimes it's an autoimmune condition, and then you have to deal with that. But if they have a hormonal issue, my favorite hormonal point is, well, stomach 9 is great. It's close to the thyroid. It's a great point for balancing the hormones. And then the endocrine point in the ear. Those are kind of my go-tos for getting those hormones balanced, which can cause some of the hyperpigmentation, unless it's sun damage, and then you've got a whole other issue. So. Okay.
Wow. Clotel snuck another question in. What about hypopigmentation?
So now the hypo is if it's, I'm sorry, it's late and I got up very early. Well, hypopigmentation typically, especially if someone's losing their pigment, is usually autoimmune. And my 58-year-old brain, the word just is completely out of my head. And I should know it, but yeah. And yes, yeah, it can help. But again, you really want to get underneath why does this person, are they losing their pigment? Vitiligo. Phew.
Okay. And then we got another, all right, this is absolutely the last question, but it looks like Doc Louie would like to know, do we have a golden period to do acupuncture on patients who have developed Bell's palsy?
No. Well, yes. In an ideal world, as soon as they start having symptoms, the sooner they come in, the better. And I've had success with people, and if you go to that Facebook group, I have a little video. One of my students had Bell's palsy years ago, and she couldn't, her mentalis muscle was the one piece that hadn't healed. And I got her on the table, I did a few points, and it like sprung back to life. So the sooner the better. And I know some people say, oh, you know, once it's been a certain amount of time, you'll never get it back. I use scalp acupuncture, I use motor points, I use submuscular needling, I use cupping. I just hit it from every angle, and you'd be surprised at the results.
Well, that is going to do it for tonight's webinar. I want to thank you so much for this incredible information. Everyone here loved it. So, you know, we want to thank everyone for showing up tonight. You know, we answered all of the questions. You will get an email with the recording following this, and we'll have the recording posted on our blog in the next week or two. For our next webinar, it's going to be November 6th, featuring Chloe Weber from Radical Roots CBD Products to talk about CBD and the brain. So stay tuned for registration for that. And please forget to check your email 5 minutes after. You'll have a discount for some select products from LASA OMS, and also a discount off of Michelle's upcoming classes. So don't forget to check your email. Thank you, Michelle, and thank you everyone for it, and have a great night.
Thank you for having me.
Thank you. Good night, everybody.